What are the myths about vitamin D that you might believe in? Vitamin D is often referred to as the sunshine vitamin because it's synthesized in our skin when exposed to sunlight. It plays a crucial role in various bodily functions, such as strengthening bones, absorbing calcium, and supporting our immune system. But as with many topics, there are often myths and facts intertwined, so let's navigate through them together. Myth number 1. Let's start by debunking the myth that the more vitamin D you consume, the better. While vitamin D is undoubtedly important for our health, excessive intake can lead to serious consequences. Taking too many vitamin D supplements can result in a condition called vitamin D toxicity, which can have adverse effects on our health. Symptoms of vitamin D toxicity include nausea, vomiting, weakness, bone pain, and kidney issues. Hence, it's crucial to stick to the recommended daily intake, as exceeding the limit can lead to harmful outcomes. Here is the fact. Vitamin D supplementation should be done according to the recommended doses to avoid toxicity. Myth number 2. There's a common misconception that we can fulfill all our vitamin D requirements through food alone. While certain foods like fish and fortified products contain vitamin D, relying solely on them might not be sufficient for everyone. Our primary source of vitamin D is sunlight, as our skin produces it when exposed to UVB rays. However, factors like skin pigmentation, sunscreen use, and limited sun exposure can affect this process. Therefore, while food can contribute to our vitamin D intake, it's essential to spend some time outdoors to ensure adequate synthesis of this vital nutrient. Here is the fact. Sunlight exposure is crucial for synthesizing vitamin D in our bodies, in addition to dietary sources. Myth number 3. We often hear is that vitamin D supplements can aid in weight loss. While there's a link between low vitamin D levels and obesity, the idea that taking vitamin D alone can lead to significant weight loss is misleading. While having sufficient vitamin D levels may contribute to overall well-being and potentially support weight management indirectly, it's not a magic solution for shedding pounds. Maintaining a balanced diet, regular exercise, and healthy lifestyle choices remain the cornerstone of weight management. Here is the fact. While vitamin D plays a role in overall health, it's not a standalone solution for weight loss. Lifestyle factors also play a significant role. Myth number 4. There's a misconception that everyone should routinely test their vitamin D levels to ensure they're within the optimal range. While it's essential to maintain adequate vitamin D levels for overall health, routine testing may not be necessary for everyone. Most individuals can maintain sufficient vitamin D levels through a combination of sunlight exposure, dietary sources, and supplementation if needed. However, certain populations, such as those with specific medical conditions or at-risk groups, may benefit from regular testing to monitor their vitamin D status. Here is the fact. Routine testing for vitamin D levels may not be necessary for everyone, but it's crucial for certain at-risk populations to monitor their levels regularly. Myth number 5. Contrary to popular belief, the vitamin D needs of women can vary depending on various factors, such as pregnancy and other health conditions. Pregnant women, especially those expecting during winter months or with specific risk factors, may require higher doses of vitamin D to support both maternal and fetal health. Adequate vitamin D intake during pregnancy is essential for the development of the baby's bones and overall well-being. Therefore, it's essential for pregnant women to discuss their vitamin D requirements with their healthcare provider to ensure optimal supplementation. Here is the fact. Pregnant women may require higher doses of vitamin D to support maternal and fetal health, depending on individual circumstances and risk factors. Myth number 6. While sunlight exposure is essential for vitamin D synthesis, excessive exposure can have adverse effects on our skin health. Overexposure to UV radiation from the sun can increase the risk of skin cancer, premature aging, and other skin conditions. Therefore, it's crucial to strike a balance between obtaining enough sunlight for adequate vitamin D production and protecting our skin from harmful UV rays. Wearing sunscreen, seeking shade during peak sun hours, and wearing protective clothing can help minimize the risk of sun damage while still allowing for sufficient vitamin D synthesis. Here is the fact. While sunlight is essential for vitamin D synthesis, excessive sun exposure can increase the risk of skin damage and should be balanced with sun protection measures. In summary, vitamin D plays a vital role in various aspects of our health, from bone strength to immune function. However, it's essential to separate myths from facts when it comes to understanding its role and how to ensure adequate intake. By maintaining a balanced approach that includes sunlight exposure, dietary sources, and supplementation if necessary, we can optimize our vitamin D levels and support overall health and well-being. Thank you for watching. Don't forget to like, comment, and subscribe. Watch more videos by clicking on this video right over here.